All right, friends, please join me in welcoming Dr. Patrice Matchaba, Group Head, Global Health and Corporate Responsibility, Novartis.
Thank you. So I'm Patrice Matchaba. This is my 19th year with Novartis on the drug development side. Born in Southern Africa, lived in the US for the last 18 years, and have been working for Novartis for 19 years. So, on behalf of Novartis, Vas in particular, the CEO who could not make it, is in Boston. And thank you to Bertrand, who's the Chief Digital Officer, and he'll be giving the headline speech, and the board of Novartis. Welcome to Basel. Now, why did we think this was important? If I could have the first slide. The other side. We started off as a chemical company, and that's the Rhine, as you can see that. But we've transformed ourselves. We are present in 120 different countries with over 150,000 associates in every field. That includes generics, oncology, innovative medicine, and eye care. And we have centers now around the world. That includes in Boston. Some of you know our discovery unit is there, in Basel, in East Hanover, in Shanghai, in India. That's the short introduction to Novartis. But the question is, why here? This is a young, brave lady in 2007 who developed acute lymphoblastic leukemia, had tried chemotherapy, failed, had tried bone marrow transplantation, and failed. And she was the first lady working with Professor Carl June in Philadelphia to be put on CUT-19, where we manipulated the T cell and reprogrammed it to fight the cancer when everything else has failed. This is the same Emma. 1 year later and 5 years later, she is now 12 years old and alive. So the question I ask myself, coming from Southern Africa, how do we do this faster and more rapidly and ensure that patients throughout the world who have malignancies and every other condition, that we can find solutions for them that we thought were impossible in terms of re-engineering and make them accessible to patients? We need your help to reimagine the practice of medicine by crunching and looking at big data so that we can increase access, not only to the discovery and innovation, but to access to medicine. But our responsibility is just not simply cancer and everything else. When I joined this role last year as head of global health, I was shocked that a biblical disease like leprosy still exists in the world. There are more than 2 million people with leprosy. And every year, 200,000 children and young adults get leprosy. The drugs have been there for the last 20, 30 years. What if we could reimagine that we could eliminate leprosy from this world by using technology in order to use diagnostics that we could use around the world? Currently, there's a shortage of close to 7 to 8 million healthcare workers around the world. If we are to use the same current model today to solve the world's problems, we have to reimagine and repurpose and use technology to help us with diagnosis so that we could meet the universal healthcare demands. So, in summary, again, as Emily would say, no one fights alone. And that's my plea for you for the next 2 days. And this is why we've been headline sponsor. We need to reimagine and not be afraid of artificial intelligence and technology, and use artificial intelligence and technology to repurpose and make sure that healthcare access is democratic. With that, thank you very much, and have a good 2 days.